Well, hi, everybody. It's Dr. Fleury, and I wanted to spend a couple of minutes just talking to you about our food sensitivity testing that we offer here at the clinic. And you may have seen an information video that Dr. Pahowicz and myself did a while back, just discussing the food sensitivity testing. And the reason for me recording this video today is because we have been getting so many inquiries about the food sensitivity testing, and I wanted to walk you through what a sample report looks like and to explain to you the difference between a food sensitivity and a food allergy. So I was just recently listening to an interview that the author of the book, The Plant Paradox, which is Dr. Stephen Gundry, who is a really well-known physician, medical doctor, cardiovascular surgeon who has done a lot of work in the field of leaky gut. And we here at True Potential and in our practices for many years have been working with that whole concept of leaky gut. And so I wanted to explain to you, what is a leaky gut and where a food sensitivity test would come in really useful in terms of helping us to determine whether or not you might be dealing with a leaky gut. So first of all, I'm going to walk you through this report and to explain to you the difference between a sensitivity and an allergy. So if you have a food allergy, you typically know it because you will have an immediate response to food. So for example, if you have a peanut allergy or a shellfish allergy, you're going to eat the food and your throat will swell closed and you may break out into hives and you may or may not require the use of an EpiPen. So that's a type 1 or an IgE mediated immune response. So that's an immediate immune response, and that is an actual allergy. So if you were to go to an allergist and they did little scratches on your skin and then put little antigens into the skin, little drops of serum into the skin, and you create a reaction to that, that's an actual allergy. So a lot of people have never been diagnosed with actual food allergies, and yet they may have sensitivity. So a food sensitivity is a delayed hypersensitivity reaction. So that means that you might not react to the food immediately. So there may be no throat closing, no, breaking out into hives, no acute inflammatory response, but there may be a delayed hypersensitivity reaction, and it can take hours to days before you manifest the symptoms of a food sensitivity. And that's why it can be really tricky to decide or to determine whether or not you have a food sensitivity, because you may eat a food on Saturday and not realize that you're having a reaction to it because your body may not respond to that food for days. So it might be, Monday or Tuesday before there's a low grade response, and you may or may not be aware that that response is happening. So that's where the value of these food sensitivity tests come in. Because what it can do is it can help illuminate or point out possible food sensitivities that you may not be aware that you're dealing with, because you're eating a food thinking that it's a healthy food. So eggs would be an example of a food that is typically, we generally assume is healthy for us, good protein, but there may be a sensitivity that you're not aware of. Nuts and seeds are another common one. We often think about dairy and gluten when when we think about food sensitivities, but there's all these other foods that you may be sensitive to that you're just not aware of. So in this report, this is a sample report, and the reports are organized in two ways. They're organized according to food group, and they're also organized according to reactivity. And I always look at this page first because I want to know how much of the page is taken up by the red and the yellow. So in this particular example, this is almost a third of the page is taken up by these foods that are elevated or a higher level of reactivity than the foods that are green. These foods show very little to no IgG reaction, and these foods are elevated. So when I look at this particular example, this would alert me to the fact that maybe this person might have a bit of a leaky gut, because there's a lot of red and a lot of foods that this person is reacting to. So then I want to know, now, is this person reactive in specific food groups, or are those reactivities kind of scattered all over the place? So we look at the top of the report, which is organized according to food group. And we see that this person has a lot of dairy, a lot of gluten-containing grains are sensitivity. The gluten-free grains seem to be okay. But as we scroll down, we can see there's a couple of vegetables jumping out at us. And then there's, quite a few nuts, seeds, and legumes. So in this particular example, there would be certain recommendations that I would be making, both to support this person around helping them to eliminate the foods that they are obviously showing an IgG reaction to. And then there'd be other sort of more comprehensive support that I'd want to suggest for this person, given that they do tend to have a lot of red and yellow foods. So they're in a fairly reactive situation. And this could point towards the idea that there might be a leaky gut. And in a leaky gut, proteins and food molecules that shouldn't be getting out into the circulation and stimulating the immune system. What we're finding in a leaky gut situation is that in fact is unlikely happening, which is triggering an amplified immune response to these foods. And then every time you eat the food, it's triggering that response again. So that's the overview of what a food sensitivity test looks like. It's a quick finger poke. We do it here in the clinic. It takes us about 2 or 3 weeks to get those results back. We sit down and we help you understand and interpret those results and then put together a plan for you. And the good news is that even though you don't ever really completely eliminate your food sensitivities, you can significantly decrease your reactivity to foods over time. And in general, can experience an elevated or an enhanced degree of wellness around your digestive tract and your ability to digest, absorb, and to get better, to get a better clinical effect from the healthy foods that you're wanting to eat to enhance your overall health and well-being. So if you're interested in learning more about this test, or if you'd like to book an appointment to come in and have a food sensitivity test collection done, any of our doctors here at the clinic can do that for you. And then we book a follow-up, and then we sit down and help you understand the information and how to move forward from it. So I hope that's really helpful, and I look forward to connecting with you.